Hello all, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. Today's group discussion topic is about paraffin wax therapy in physiotherapy practice. It is a most commonly used superficial heating modality in physiotherapy practice. Here we have set of students, they are going to discuss about the definition, principles, indication, contraindication, advantages and clinical application of the paraffin wax therapy. Let's begin with the definition from participant 1.
Myself Archia, I am going to talk about intro about wax bath. Wax bath is a thermotherapy modality in which paraffin wax is applied to the body, especially foot and hands, to provide superficial heat. The wax is mixed with mineral oil to reduce melting point and prevent burn. It helps in reducing joint pain, stiffness, mostly used in chronic conditions.
Yes, thank you. Let's move on to the principles of the paraffin wax therapy.
I'm Alibadma. I'm studying third year PPT in SNS College of Physiotherapy. Now I'm going to share about the principle of working. Paraffin wax bath works on the principle of conduction, where the heat is transferred from the warm wax to the tissues. It has low thermal conductivity, so it spreads heat superficially, slowly and uniformly over the skin, which reduces the risk of burns. When the wax solidifies onto the skin, it creates a compressive and insulating effect which retains heat for a longer duration.
Yes, that was well explained. Let's move on to the physiological effects of paraffin wax therapy by participant 3.
Hi, this is Pavitra. Let's discuss about the physiological effects of paraffin wax. Vasoconstrictions, which increasing the blood circulations, and muscle stiffness, reduction of the muscle stiffness, reduced joint stiffness.
Yes. What are the other physiological effects?
Pain relief due to the nerve, pain relief due to the reductions of the
Nerve compression. The nerve conduction velocity will be increased. Yeah, that's good. Then next we'll see about the contraindications of the paraffin wax therapy and indications of the paraffin wax therapy. To start with the indication.
Hi, I am Subhasri. I will tell about indications about paraffin wax therapy. Paraffin wax therapy is indicated by chronic inflammatory conditions, rheumatoid arthritis, osteoarthritis, post-immobilization stiffness, and scar tissue formation and adhesion, stiff hand and stiff joint for the hand and both foot. And it is commonly applied before the stretching and mobilization techniques.
Yes, these are all the most common indications which we will prefer to use the paraffin wax therapy. Understood? So next we'll move on to the contraindication points.
Hi, myself Vaishali. I'm going to tell about the paraffin wax contraindications. Contraindications have more, so I tell something.
Yes, what are the most common contraindications?
Skin infections, open wound skin infections, acute inflammations, recent burns, and
Yes, we have to check for both the local contraindication and absolute contraindication. In case of the absolute contraindication, we have to check generally the temperature of the patient, whether the patient is having any pyrexia or any general skin diseases, we have to check for it. Then in case of local contraindication, the place which you are going to treat exactly need to be thoroughly checked before applying the paraffin wax therapy. Since it's a superficial heating modality, the heat applied on the part of the treatment area can cause many of the adverse effects. So that you have to check for the skin clear infections or any open wounds or any open cut bleeding or any of the dangers which is related to metal implants in the area which we are going to treat. These are all the contraindications which you have to specifically check before applying the paraffin wax therapy. So next we move on to the other participant for the some points. Yes.
Okay, I'm Sindhu from SNS College of Physiotherapy. I'm going to tell advantages of paraffin wax. Easy to administer, uniform heat sufficient, cost effective, and mainly used for small joints such as fingers and toes, and it is minimal risk when used properly.
Yes. So there are many advantages in the paraffin wax therapy in clinical practice. The first one is which is easily applicable to the patient, and it is reliably, readily available in the market, and it's also very cost effective. So you can use the paraffin wax therapy whenever it is necessary. So you need not to switch on the paraffin wax unit throughout the day. Whenever the patient is needed of the paraffin wax therapy, in comparison with the hydrocollector pack, we have to switch on the machine for about 1 to 2 hours prior to the treatment, so that the hydrocollector pack will get more amount of the heat inside the pack. But not like in the paraffin wax therapy, we can switch on the machine even before 15 minutes of the treatment. So the paraffin wax get once melted, we can clearly use for the treatment purpose. So that is the basic advantage of the paraffin wax therapy. So in future, in case if you are going to deal with any of the inflammatory conditions of the major joint, please prefer to use the paraffin wax therapy. So which is easy to use and it is also more effective in treating the pain as well as in reducing the stiffness. You can give the paraffin wax therapy before mobilization. That will increase the range of motion majorly. Clear? So thank you all for your valuable participation. Thank you.